My name is Justin. I suffer from multiple sclerosis, a very aggressive version of the disease. One that's left me in a wheelchair a couple of times, and about a year ago, I was in a wheelchair, and I was told that I wouldn't get out, and I was looking at chemotherapy, and if the chemotherapy didn't work, which it has a poor success rate of, I would have been signed up for a bone marrow transplant with stem cell. It's a process that had some success, some really good success. Unfortunately, there's a 5% mortality rate, and at least a year on the good end of rehabilitation. So yeah, it was like, okay, well, what else? Maybe this cannabis can actually work. So I got a pound of marijuana, and I basically made it into oil infused into coconut oil. Pulled myself out of the chair. First, I took steroids. Those stopped the inflammation, the raging, and then I began a cannabis therapy, and I was coming back, and I was so far gone. So it's been a year of using cannabis as a disease modification therapy, and I've been doing great. But unfortunately, the last few months, my supply I've been using subpar medicine and less of it. So as that's been happening, my perfect dose, I guess, it was perfect, because anything less and my disease started to come up on me. I just got steroids again. It's been like weeks of just the inflammation raging and raging, and my medicine's not strong enough to back it down, and the beast has gotten too powerful. So I got an infusion. That was a bit of a fiasco, but I'm not going to get into that now. I'm going to take it for another 3 days. It's the equivalent of 2 500 milligram doses of prednisone in a day for 4 days, right? So 500 milligrams prednisone twice daily for 4 days. Yeah, this is it's an infusion. That's the equivalent of, if you're familiar with prednisone. Anyways, yeah, then it's MJ versus MS, you know, marijuana versus multiple sclerosis. I think I have it down. I have it pegged. I just need my medicine and the right amounts of it, and I'll be really good for a while. My doctor wants to meet in January and see the MRIs we're gonna do and see exactly how well cannabis is working as a disease modification therapy, and he's going to take it seriously. He's also going to judge how well I'm doing when I go in there in January. So I'm looking forward to that. I'm going to keep a lot of notes and take this very seriously. And I'm going to go into that meeting with as much ammunition as I can to try and convert him to a medical marijuana doctor. Or at least to allow it in his arsenal, or pardon me, in his medicine cabinet. Yes, that would be great. If you know someone with MS, tell them to tune in. This could be extremely educational. I know I could have used this 2 years ago when I began my battle to and some. So yeah, like I said, my name's Justin, and this is MJ versus MS.